David Blyde. I'm a consultant veterinarian and I've come to Zoodoo this week to do a few things. The procedure today was to look at Kiara, who's a 13-year-old female lioness, and she had this quite nasty lesion on her lower right leg, and we needed to work out what that was to give us some idea of how to treat that. So, you know, obviously working with animals that are dangerous, we need to sedate them via projectile darts and make sure that everything's safe for that. But they do pretty well under anaesthesia. They're really just, as their name implies, just big cats, and they do everything pretty much the same as domestic cats, except you know, everything's supersized. So the endotracheal tube's large, the catheters are large. We need to use a lot more volume of drugs, etc., for those animals. When we immobilise these animals now, we have good equipment, and we like to make sure that the anaesthetic is being monitored, so we can monitor heart rate, partial pressure of oxygen, so making sure that they're getting enough oxygen during anaesthesia. We give them intravenous fluids while they're down, antibiotics. So yeah, look, it's we make sure that the animal's getting the best of care while we have it sedated.
When we put her on the machine at 11:21, and it's now 12:24, so she's been on the machine for an hour.
The drugs we use on those animals now are very good, and they're consistent. And having done quite a few, I'm very confident in what I do. So I don't have a lot of nerves about going in with the animal, because we don't do it unless they're really sedate. So yeah, zoo medicine's come a long way, since I've been working in it, the last 30 years. And like I said, the drugs are very good, consistent, very safe for both the animals and the people that are working with them. So my job yesterday was just to oversee the procedure and make sure that the anaesthesia went well, and that the animal was getting the right treatment during the procedure. And we had Dr Chris Lee from Kingston Animal Hospital out, and it allowed him just to concentrate on the surgery of the wound and that, so he didn't have to concentrate on anything else. But the procedure went pretty smoothly, and now we're just awaiting the results of the biopsy and the bloods from that cat to move forward on how to treat it.